Hello, my name is Rhiannon Montgomery, and I will be explaining to you diabetes and obesity as it's related in Santa Ana. The health-related problems that I noticed here were definitely obesity and diabetes. As it relates to obesity, there's low income in this area, which relates to choices in fast food because it's basically what they can afford, which ultimately is not very healthy and causes them to be obese. And most prevalently is the childhood obesity seen here, which carries over later into adulthood and into a lifetime of habit forming. And obesity and diabetes are directly related to each other. There is an increased prevalence in diabetes within this community, which is a Hispanic, lower income community. And overall, speaking with some people, there was a lack of education and adherence to the management of diabetes. This is significant because 1 in 6 fifth graders is obese, and the highest rates of these obese children are in Santa Ana, which is a Hispanic community. It's actually increased 22.4% in Hispanics, which is the diabetes. Hispanics also have a 61% higher death rate from diabetes compared to other racial identities. So this is very, very important in Santa Ana since it is the highest racial group within the community. The average household income in this city is $54,392, which is less than the average U.S. income. So it does show that they are lower paid. And there is a large Catholic base, which one study showed that there is fatalism, which is the belief that God is in control, and things such as their health are beyond their control. So kind of lack of initiative to seek help. Healthy People 2020 objectives were one in relation to obesity, showed that there was they would like an increase in the variety and contribution of vegetables to the diets of the population aged 2 and older. So get that healthy start from a young age. And they want to increase incentivize food retail outlets to provide foods encouraged by the dietary guidelines for Americans, basically providing overall healthier food choices to people. Now, related to diabetes, they want to reduce the death rate among persons with diabetes and have them, not die from something that can be managed a lot better, just simply due to education. And they want to improve glycemic control among persons with diabetes. So this relates to the A1C levels, that 90-day test that shows management of sugar levels. The needs assessment was most prevalently understood first through the windshield survey. I was able to determine definitely that there was a need here through the overall community, the quality of the community, looking around and seeing a lot of obese people, just the care they took themselves. And interviews, I interviewed a nurse practitioner who she believed the health problems was uncontrolled diabetes, alcohol levels, and the poor choice in food among the young and young pregnancy ages. Another resident of Santa Ana said that she believed obesity was important to speak about. She says, especially kids with all the bad food options around here. Theoretical framework was the Precede, Proceed. It's an 8-phase pathway to plan intervention programs through an educational and an ecological view. So the intervention here was picked for us, the health education classes. And when I started to do my windshield survey, I definitely saw an ecological approach first. I saw the needs. I saw the overweight people walking around. I saw the billboards for fast food, a lack of people walking around, walking their dogs, exercising. And through my research online and through interviews in which I spoke to people, I was able to get an educational approach and kind of understand what needs that the community themselves thought would be most needed. So who needs the intervention? How can I reach it? Is people of this community, Santa Ana, that were of lower income and have chronic illness such as diabetes and have poor food choices based on either just a lack of education or a lack of available resources. And the most amount of people I could reach was through the shelter. There are a large amount of people that stay there, but they are a specific group of people. So the issues that I came across here were first, the educational barriers. There's definitely a lack of health education, just of what are healthy food choices and why are they healthy? Why are vegetables healthy? Why is the vegetables in my hamburger not healthy? Just kind of opening their minds to things like that. And a lack of disease process education or management. So they don't understand the process of diabetes. They don't know how obesity is related to diabetes and how diabetes is related to death and why they have to manage their diabetes. Speaking with people in the community, I definitely saw this. And they weren't able to identify resource centers that they had that were sometimes even free to them. When I asked them, what are the options, they weren't able to speak of any. And the nurse practitioner that I did speak to said that there are some in the area, it's just they're not being utilized as they should. Some practice barriers were access to healthy food and affordable health care. There is a low income within this neighborhood, and they are not able to purchase some of the healthiest foods or health care. But an asset within this community is the presence of these resources that they already have in place: diabetes screenings, diabetes education programs through the shelters, WIC, which is Women, Infant, Children's, wellness councils, Walk to School Day, Heal City. So they definitely know that the city knows that they need to inspire kind of this initiative to get healthier. It's just the people that need it aren't aware of it and aren't being educated in regards to these resources that they have. The interventions related to the issues, the intervention was the education class. So it educates a population regarding healthy food choices, the process of diabetes, what it is, why it is important to manage this, and where to go, what kind of resources do these people have available to them, and why do they need these resources. This relates to Healthy People 2020 objectives because, like we mentioned before, it increases the population will know how to increase the variety of vegetables into their diet and be able to teach their children that so they learn that from an earlier age. Hopefully, understanding the diabetes process better will reduce the death rate among persons with diabetes because they will know how to manage it. Managing it involves checking their sugar, eating properly, which improves their glycemic control. So it will meet 3 of these Healthy People 2020 objectives. And the intervention that I did pick was the educational class. And specifically, it begins with a lecture. I've given a handout before the class so that the class can follow along, provide the lecture, and then following up with interviews. Either this involves kind of just opening a question period for everyone so I can question them and see if they have retained information I have showed them, and also if they have questions as well. So the class began with obesity and nutrition information, and then kind of stems into diabetes and how those are all actually related to each other. In regards to obesity, this was the outline that was performed and a guideline of the handout that was given as well. The handout had more specific facts, but basically I started with, why is weight status important? How does this affect anything except, appearance? And then for the population, what can they do to eat healthier? What options are available to them, and why is what they're eating not healthy? And why and how do they become healthier? Increase physical activity, local parks, and then what are their resources? Kind of defeats the purpose of me showing all this to them if they don't even have the ability to do that. And then it stems into diabetes. Same thing. Why is it important? Why should they be educated on this? How prevalent is it? Is it, this, oh, I might have known someone with that disease, or is it more common than I think? And then actually tell them what diabetes is. And then if they do have it, how do they monitor it? How do they fix it or treat it? And then obviously, again, what are their resources here? Resources within the shelter or screenings, and then even preventative measures. In regards to the budget, it actually was very low cost. Pretty much just needed to pay for the paper for the handouts, which the organization did not want to cover, but I could easily cover. And then no cost for the staff. I just used the volunteers there that were unpaid to kind of just get their organizational support, which was kind of setting up physically for the class with all the chairs and kind of gathering people during an open time when I could speak to the most amount of people. The only real other thing was education of staff or follow-up. So if the participants did have questions after, or they did want to get some of those resources, it was just important to me that staff knew of the available options and they were educated prior to the presentation. So the goals that I had for this class was to increase the healthy food choice options and make sure that the population was aware of it, have diabetes education on the actual disease of it. I wanted to reduce the number of diabetes-related deaths, especially if it was just related to an educational deficit. I wanted to increase diabetes management adherence, whether it's just checking their sugars or making better food choices, and inform the population of the resources that are already in place and available to them. The way I can measure this success or failure is through the number of diabetes-related deaths, which is what I was concerned of, the use of resource centers, just seeing how many patients are coming into those resource centers, what kind of resources they're using within it. Are they just speaking to people, or are they getting handouts or tools, glucometers, things like that? And checking the BMI of shelter residents. So when they come in and, we speak to them, just kind of following up, checking their BMI real quick and seeing if there is a decrease in that and what the decrease is for, if it's better food choices or just lack of overall food. That kind of defeats the purpose there. So my short-term evaluation will be those immediate interviews and surveys that I speak to people within the shelter, even for days and weeks afterwards, just to make sure that they still are retaining all the education and that they understand why it's important and that they're not just doing it for me, just to recite something back. Long-term evaluation would be overall reports such as a census that would include death rates or causes of deaths, CDC, which would show similar things, and even windshield surveys. That's initially what caught my eye. So just looking through these neighborhoods and seeing, does it look like there are less billboards for fast food because they're not as popular anymore? Are the obesity rates, do they appear lower? The results were basically there's a low income, which there's a lack of proper education in health choices, in disease processes, etc. And this lack of education results in poor food choices. They just simply don't understand why they need to make certain choices. And that then relates to obesity, which causes chronic illnesses such as diabetes. Unfortunately, there were some deficits in this project, which was childhood obesity was very, very prevalent in this community. But the shelter that I spoke at was adult only. So there was that missed audience, although those adults can pass the information on. The intervention did reach many people, but like I said, it kind of missed an audience and they weren't really responsive. There were a lot of people within the audience that had mental illnesses or seemed that they were under the influence of drugs or alcohol. So it was kind of hard to ensure that they were paying attention. And things like an income status, it's hard for me to change that, but it's easier for me to provide information as to what is already available within the community at a low or no income. And the changes I would make was I would prefer to provide this class at least in two separate facilities. One I could have done at the shelter, yes, and another maybe in a church or youth group or a school so I could encompass a larger amount of people. And these are my references. Thank you very much for listening to my presentation.